Today, we're going to talk about a super important topic that could save your life and the lives of people close to you. Before we talk about what a stroke actually is, let's discuss how the brain works. Everything, absolutely, everything that happens in our body is controlled by the brain. The movement of our hands, the movement of our arms, the way we walk, take steps, speak, the functioning of our organs, everything is controlled by the brain. Our entire body has a network of neurons that communicate with each other, capable of generating absolute intelligence for our body and producing movements and health in everything we do. A stroke is a cerebrovascular accident that happens due to the interruption or reduction of blood flow in a certain area of the brain. There are two types of stroke. The ischemic stroke, which is an interruption or reduction of blood flow in a specific artery or important vessel in the brain, and the hemorrhagic stroke, which is the rupture of an important vessel, artery in the brain, both ischemic and hemorrhagic. Strokes cause functional changes in our body. It can be changes in movement, visual changes, changes in sensitivity. It will depend on where this stroke occurred in our brain. Currently, the causes of a stroke are very clear. There are strokes that occur in a hereditary way. Patients who are born with a change in a cerebral artery, a malformation of a cerebral artery, can experience a rupture of that malformation, leading to the formation of aneurysms. This happens in children, teenagers, and adults. Other causes, and perhaps the majority of these causes of stroke, are lifestyle habits. The functioning of our brain happens through the communication of large neural circuits. Each area of our brain is responsible for a function. Each function is established by a circuit of thousands of neurons that communicate to carry out simple functions of our body. There's an area in the brain that's very important, which is the motor area of the brain. This area of the brain represents everything. That involves movement in our body. There, the movement of the right hand is represented, the movement of the left hand, the movement of the arms, the movement of the legs, the ability to hear, the ability to speak, to see. Each area of our brain has a specific function. Stroke is one of the leading causes of death in Brazil, surpassing acute myocardial infarction. That's why this topic is so important. Share all this information with everyone who needs to know in some way about the health of the brain. Can we prevent a stroke? Yes. Healthy lifestyle habits keep us away from that possibility. Is it possible to know if you're having a stroke or not? Yes. There are warning signs that your body gives when something isn't right in your brain. Yes, symptoms can occur before a stroke. Signs like headaches, body imbalance, blurred vision, and changes in movements at some level can happen even before a stroke. Signs like stress and anxiety are often mistaken for warning signs from the brain. It's possible to identify the signs. The stroke is happening. You can identify an ischemic stroke when the patient has difficulty moving their arm, trouble smiling, speaking, expressing themselves, difficulty moving, or weakness on one side of the body. These signs are warning signs that need medical attention. On the other hand, a hemorrhagic stroke often comes with a sudden and intense headache, really out of nowhere. In this way, they can also be accompanied by dizziness, nausea, and especially body imbalance. When a person shows these symptoms, medical attention needs to be immediate. Today, there are hospitals with stroke units that provide prompt and effective care to look after the health of these patients, who can identify and detect exactly what's happening in the brain within minutes of the patient arriving at the hospital. This way, it's possible to establish specific stroke protocols that are now validated by scientific literature to save your life. Both medications that can dissolve the clot in a chemical stroke and surgical interventions like thrombectomy are extremely effective treatments backed by scientific validation that can significantly reduce the after effects on your body. Up to 4 hours from the first symptoms of a stroke, if the patient is helped immediately, the after effects they experience can be significantly reduced. Today, biopsychosocial models talk a lot about quality of life. If we build our health over the years, we eliminate any possibilities of having diseases like stroke. Studies show that smokers have a 2 to 4 times higher risk of having a stroke compared to non-smokers. Regular cigarettes contain thousands of toxic substances, including nicotine, tar, and carbon monoxide. These substances cause serious damage to the blood vessels. Among them are high blood pressure, atherosclerosis, which is the buildup of plaques in our arteries. Over time, these factors can lead to the blockage and rupture of blood vessels, significantly increasing the chances of having both ischemic and hemorrhagic strokes. Although e-cigarettes are marketed as a less harmful alternative to regular cigarettes, they are also not without risks. E-cigarettes contain nicotine in their substance. This nicotine can cause vasoconstriction and increased blood pressure, along with other toxic substances that can cause inflammation and oxidative stress in the blood vessels. Research indicates that regular use of e-cigarettes can significantly increase risk of cerebrovascular diseases like stroke and other vascular changes. Even more so when that person has a family history and associated risk factors. A stroke is nothing more than the result of poor health built up over the years. It's part of physical, emotional, and also spiritual health. When we talk about physical health, it's about maintaining healthy diet, proper hydration, and adequate physical activity, keeping our lungs and heart functioning well, and improving our blood circulation. All of this affects our ability to live a life without any risk of stroke. When we talk about emotional health, we're talking about cultivating good relationships, positive thoughts, and making good choices throughout life. There are many patients in many clinical cases of people, athletes who are extremely healthy, who maintain a proper diet, adequate hydration, and physical activity, but live under absolute stress. These people also have the risk of having a stroke. So, if you want to minimize the risks of having a cerebrovascular disease like a stroke, an autoimmune disease, or any other chronic illness, it's important to maintain your physical health, emotional health, and spiritual health. In this way, you can have lifestyle habits that will lead you to a full life and a life full of health. Acting quickly can save lives. Share this content and subscribe to our channel.